Hello, everyone. If you're on Medicare, Medicaid, Social Security disability income, or receiving food stamps, you've probably heard some alarming news and people saying that President Donald Trump has frozen all of your benefits. But before you worry about that, let me put your mind at ease and tell you, you are not losing your benefits. Yes, you heard that right. Stay with me for the next 10 minutes and I'm going to break down the truth behind the recent executive order and dispel some of the myths that have been circulating and explain why your benefits are safe. And if you still have questions after that, I'll tell you exactly how to get help where you need it. So let's dive in. First off, let's address the elephant in the room. On January 20th, 2025, an executive order was signed by President Donald Trump. There has been a whirlwind of confusion since, with rumors flying around that this order would cut benefits for millions of Americans, including those on Medicare. But here's the crucial part. The executive order explicitly states that programs providing direct benefits to Americans are excluded from this review process. This includes Medicare, Medicaid, Social Security, SNAP, student loans and Pell Grants, and even Head Start and more things. So no pause, no freeze, no loss of benefits for these people. Now, as you know, here at PlanFit, we specialize in helping people navigate Medicare insurance. And we have received numerous calls from our worried clients, and I'm here to clarify that this is not a freeze on your Medicare benefits. The confusion stems from a misunderstanding of what the order is intended to do. Now, I don't work for the White House. I am not here to speak on behalf of President Trump or anyone else, but I am able to read and understand and review and cut through all of this stuff because I've done so much work in Medicare and understand a few things about what it's trying to accomplish. The order is trying to unwind certain federal policies and review and potentially unwind things, but it's not aimed at cutting essential services for Americans. Now, to further reassure you, I can explain to you how these programs are funded. Medicare, for instance, is funded through trust funds, payroll taxes, and premiums. These are not directly discretionary federal grants or loans that are under the executive order. For example, the trust fund is the money that you paid into Social Security while you were working. That's not federal money or federal grants. Payroll taxes are coming from people who are working right now, and this money is coming out of their payroll taxes. Again, that's not discretionary federal spending or federal money. And then premiums is money that you're paying in to Medicare for your Part B. Again, those are not discretionary federal grants or loans, so the order doesn't affect those things. We could say something similar about Medicaid funding, which comes as grants to the states, and the funding structure there remains untouched by the executive order. So here's a simple breakdown. Medicare is funded by the Medicare Trust Fund, again, not subject to the executive order's review. Medicaid is federal funds to states that will continue as usual. Social Security operates its own trust fund separate from the order's scope, and SNAP is administered through a separate funding mechanism. Now let's talk about some of the misinformation that has been spreading. For example, some have claimed that Medicare payments are being halted immediately due to Trump's executive order. And this is completely and blatantly false. Here's another one. Millions will lose Medicaid coverage overnight because of the funding freeze. Again, this is not true. The executive order does not touch Medicaid funding at all. There was also a rumor that Social Security checks will be delayed or stopped, which is misleading because Social Security operates independently from this order. These inaccuracies have caused unnecessary panic, and it's important to address them head on. I understand that all the news swirling around this can be scary, especially if you rely on these programs for your health care, for your income, for food, or other basic needs. But I want to assure you that based on everything that I've studied and read, and based on, if you look at the source of the information, the systems are in place and are designed to protect you, so the executive order is about administrative efficiency and not about stripping away your support and the things that you've come to depend on. If anything, it's about ensuring that these programs continue to serve you efficiently. Now, here are some real scenarios where people are worried, honestly, for no reason. We had a client call us convinced that her Medicare Part D prescription drug coverage was going to be canceled. We assured her that nothing had changed with her coverage. Another caller thought that their Social Security payments were going to stop. We explained that Social Security is funded separately and not affected by this order. Now, if you're still feeling uncertain or you need help understanding your Medicare options, that's where PlanFit comes in. We are unbiased, licensed insurance agents who specialize in Medicare. We're here to guide you through your options, answer your questions, and help you find the plan that best fits your needs. Don't let misinformation right now cause you stress. You can reach out to us, you can text us or call us, or even comment below and we'll get back to you. Remember that your peace of mind is our priority. Okay, that's what I had to share with you today. I hope that reassures you that some of the things you may be seeing online or on TV are exaggerated or false, and that you're more informed and that you are at peace knowing that your benefits are safe with Medicare, Social Security, Medicaid, disability, etc. As always, we put out information as timely as we can to keep you updated on things that are happening in all the world of Medicare. So consider liking this video and subscribing for the content that we share in the future. That's all for today. We'll see you on the next one. Bye-bye.